Hi, my name is Layla Zurak, and the law that I selected was the Protection and Affordable Care Act. Um, Basically, it's a federal law that was signed by Barack Obama in 2010. It has many rules for healthcare insurance companies and how they should operate. It doesn't matter if you're insured or self-funded. Um, it affects healthcare coverage. Other areas that it affects is the funding of primary health care and how hospitals and an entire healthcare system are to be paid. There's been a lot of changes, especially with the Medicare Advantage. Um, I'm going to talk about the impact that Patient Protection and Affordable Care Act has had on individuals, the employer, and payer. But I'd like to kind of start because my personal opinion, I think that the Patient Protection Affordable Care Act has probably affected individuals the most. But I'm going to go back here. For payers, it's impacted them since 2014. Um, Payers have actually become stronger because of the Patient Protection Affordable Care Act. They're not required to sell healthcare insurance, and they can put restrictions on healthcare enrollment. But the one important thing is payers do have the influence to standardize and incorporate effective research in the United States, which can actually improve healthcare systems across the board. And Patient Protection and Affordable Care Act, how it's impacted employers is they could actually be penalized if they don't provide healthcare insurance for their employees. Um, they have the right, if they have a healthcare plan, they have the right to use that and offer that for their healthcare employees or just employees in general. Um, but new employees need to be added to the healthcare insurance. And employers do have the right to compare healthcare coverages that are being offered. Uh, like I said before, the main, I think, that the Patient Protection Affordable Care Act has affected individuals the most. Individuals, if they do not have health care insurance, they will be penalized. How they do it is when you apply to get your income taxes done, you actually end up having to pay a fee, or it ends up getting deducted in your tax refund. It does help individuals that are low income to be able to afford to buy healthcare insurance and have that healthcare insurance coverage. Again, just like the employer, the individual does have the right to, um, you know, look into whatever healthcare insurance that they want provided from them, whether it's Obamacare or their employer's healthcare insurance or a healthcare insurance that's not provided by either or. Individuals, they can add family members to their healthcare insurance that they already have. It does help people that are low income. A lot of times that could be people that are working part time, people that work in retail, and then people that work in food services. They could actually, have be offered lower premiums, which is a good thing. Um, Individuals will have medical coverage for emergency medical conditions, which is always good. They could get medical coverage, even if they can't afford healthcare insurance for much serious conditions. You have individuals that have a lot of health problems versus some that might not have any at all. Um, and then also, um, any person that lives in the United States will be offered can have healthcare insurance even if they have pre-existing conditions. Then we come across individuals that take early retirement from 55, and that's before Medicare is available at 62, so they could actually qualify for the Obamacare insurance. Um, One thing that since the Patient Protection and Affordable Care Act has come into place, a lot of place of employments have put in wellness programs. These wellness programs, if you participate to improve your health, you will be rewarded. With my wellness program at my place of employment, I actually get $24 every 2 weeks, which is helpful for me and my family. Um, and then also, even if like uh, you don't meet the health requirements that your physician has, you could still also get these rewards. My physician requires your body fat to be 30% or less. I am much higher. And even though I'm still trying and I'm participating in the wellness program, I still get those rewards regardless of how my physician feels. And then also, last thing, the Affordable Care Act is actually impacted individuals by providing 32 million people with healthcare coverage. And lastly, I have my 3 references, and I hope you enjoyed my screencast. Thank you.